YouTuber. I don't have any subscribers or anything like that. Just thought I'd do a video of how it's been for me to have a ACDF, anterior cervical discectomy and fusion. I had 2 levels done. I'm 47 years old. Today is, if you count 0 as the day of surgery, I guess today's 2, day 3, depending on how you look at it. I had 2 herniated discs in my neck, and I had some chronic pain from the military years ago, over 20 years ago, but about 3 months ago it got significantly worse. I had several rounds of muscle relaxants and steroids and injections in my shoulders to see if it was just muscle spasm trying to make it go away. Finally did x-rays that showed degenerative disc disease. Then we proceeded to an MRI, and long story short, saw a neurosurgeon at Duke University, and he said it needed to be fixed. It's only going to get worse. As far as symptoms, I never had pain radiating down in my arms. I had some subtle numbness and dropping some things, but nothing like you hear a lot of people have severe pain down their arms. Mine was all neck pain, like you had a vice just squeezing my neck, and still is. So my 2 discs retropulsed backwards into my spinal cord, so I had spinal cord compression as opposed to nerve root compression. You can look up the anatomy on that. So I had my surgery December 3rd. Today's December 5th. Still in a lot of pain. No radiating pain on my arms, just a lot of pain. I feel better with my head directly over in my body. If I lean back or forward anyway, I have a lot of pain. The muscle relaxers have been very helpful. The nurses in the hospital tried to tell me to take the muscle relaxers after surgery, and I was a little resistant to that. Should have done it. It did help a lot. The Flexerol's been helping me a lot. They don't really recommend anti-inflammatories. I guess it can, it can thin your blood a little bit and make you bleed. I do have a significant scar on my neck. Let's see if I can show it to you. And it's doing okay. I think it looks all right. We'll keep monitoring the progress of that. Wife's not home right now to put this back on, so I'll just be real still. Anyway, I'm taking hydrocodone for pain as needed. It's been rough. It's been rough, but I'm sure it'll get better over the next few days. I did have some collapse of the vertebrae. I think the surgeon said I'm having a lot of pain because my vertebrae had kind of collapsed because the discs were pushed backwards. So when he put the artificial disc space, or the cage, in there, he cranked it up a notch or 2 to expand the disc back out to give me my height that I had lost. He said that's causing a lot of spasm of muscles. Again, I think that's why I've seen some videos where people recover very quickly and don't have a lot of pain. But I think because I lost the disc height at 2 levels and he really turned the spacers up, maybe that's why I'm having more pain than some others. Or maybe I'm just a wuss, I don't know. But anyway, make sure you have a nice recliner to sleep in. Make sure you have some sippy straws with bends in them so you can stay hydrated. And the narcotics will make you not be able to have a bowel movement. So be aggressive with mineral oil and stool softeners and Senecot. So I might do another video in a few days from now. But again, it's been a rough ride. So have somebody to help you. For sure, you're not going to be able to get. I can walk around no problem. It's just the movement of my head. It's just any movement of my head is significantly painful. And of course, you have the pain with swallowing from this. Every time I swallow, this hurts. So, but no problem breathing. I've gotten all my pills down. Nothing's getting stuck. Airway's clear. So, don't remember a thing about the surgery. Hallelujah. Recovery was nice. All right.